Okay, hello, my name is Annette Harris. I'm a clinical social worker with Montgomery County Public Schools, and I will be presenting on attention deficit hyperactivity disorder, commonly referred to as ADHD. The objectives for this presentation are to understand the signs and symptoms of attention deficit hyperactivity disorder, to better understand when professional intervention may be necessary, to better understand the role of equity in ADHD, as well as the role of stigma in ADHD, and to learn about available resources. So there are actually 4 subtypes of ADHD, and they are ADHD combined type, predominantly inattentive type, predominantly hyperactive impulsive type, and ADHD specified other. So let's take a look at each subtype, starting with ADHD combined. Now for a combined diagnosis, criterion A1, which are the inattentive symptoms, and criterion A2, which are the hyperactivity impulsivity symptoms, must be present for a minimum of 6 months. So the criterion A1 inattentive symptoms are fails to give close attention or makes careless mistakes, often has difficulty sustaining attention, often does not seem to listen when spoken to directly, often does not follow through on instructions and fails to finish schoolwork, chores, or duties, often has difficulty organizing tasks and activities, often avoids dislikes or is reluctant to engage in tasks that require sustained mental effort, often loses things necessary for tasks or activities, is often easily distracted by extraneous stimuli, or is often forgetful in daily activities. Okay, so criterion A2, these are the hyperactivity impulsivity symptoms, and they are often fidgets or taps hands or feet or squirms in seat, often leaves seat in situations where remaining seated is expected, often runs about or climbs in situations where it's inappropriate, often unable to play or engage in leisure activities quietly, is often on the go, action as if driven by a motor, often talks excessively, often blurts out answers before questions have been completed, often has difficulty waiting their turn, and then finally often interrupts or intrudes on others. Okay, so in addition to the minimum 6-month requirement, several symptoms must also be present before the age of 12. Several symptoms are present in 2 and more settings. So let's say, for example, the home setting and the school setting. The symptoms interfere or reduce the quality of functioning, and symptoms do not occur during another disorder, nor are they better explained by another disorder. So these criteria are important because almost every child at some point struggles to stay in their seat or talks excessively. So the criterion serves as a way to differentiate between typical childhood behaviors and a diagnosis of ADHD. So now I'm taking a look at a predominantly inattentive type. At least 6 inattentive symptoms are present, but less than 6 of the hyperactivity impulsivity symptoms are present for the last 6 months. So just as a review, the inattentive symptoms are makes careless mistakes and shows little attention to detail, doesn't listen when spoken to, often loses important items, forgetfulness and distractedness, struggles to sustain attention, difficulty paying attention, not following instructions, and reluctance to embark upon tasks requiring sustained attention. So ADHD predominantly hyperactive impulsive type is really the reverse. So these symptoms are, just as a review, often fidgets and squirms, taps fingers, climbs and runs in inappropriate situations, constantly on the go, burst out answers before questions are completed, frequently interrupts others, frequently leaves seats, struggles to play or engage quietly, talks excessively, and struggles to wait their turn. For attention deficit hyperactivity disorder, other specified and unspecified attention deficit hyperactivity disorder, these categories are for disorders with many of the symptoms of inattention or hyperactivity impulsivity, but they do not meet the full criteria for one of the other three types of attention deficit hyperactivity disorder. Still, such symptoms are found to cause clinically significant distress or impairment. So this begs the question, is it ADHD? So it's important to note that symptoms, perhaps those triggered by trauma or stress, can mimic the symptoms of ADHD. For example, an inability to sustain focus or forgetfulness or distractedness. Given this, it's important to talk to your mental health care provider so that appropriate interventions, whether we're dealing with ADHD, trauma, or stress, can be provided. So within the school system and society at large, there's been an increased focus on equity and stigma. So let's take a look at those two areas as they pertain to ADHD. So Black and Hispanic children are diagnosed with ADHD at a lower rate than their white counterparts. And this is not the result of white children being over-identified. Additionally, once Black and Hispanic children are diagnosed, they are less likely to take medication than their white counterparts. And there are various reasons for this, and some of those I'll touch on shortly. ADHD behaviors are often seen by teachers as defiance and misbehavior. And what's unfortunate about this is that having an accurate diagnosis brings about more understanding, assistance, and support in the classroom. Untreated ADHD has far-reaching long-term implications. So children with untreated ADHD are perceived as defiant or difficult, and this can lead to suspensions. And so what we do know is that being suspended once or twice is highly associated with juvenile justice center involvement. Implicit bias among healthcare providers is a factor in the underdiagnosing of minority children. And minorities are often diagnosed with severe conditions, while their white counterparts who are presenting with the same symptoms are diagnosed with milder conditions. And actually, research shows that implicit biases in white America are currently at the same level as they were back in the 1950s. Children of color are more likely to have public insurance, making getting a diagnosis difficult because wait lists at community healthcare centers are long, and therefore treatment is harder to access. Mental health behavior issues in minority communities are often dismissed, downplayed, or viewed as disciplinary. And this also occurs in minority communities where acceptance of a mental health diagnosis is difficult. It's usually seen as a stigma, and there's a mentality of pull yourself up by your bootstraps, and that can be a barrier to getting treatment. Some minorities feel that their child is being targeted unfairly and labeled, and that this is the result of racism. And so usually having diversity in schools and diversity in the mental health profession is important to address these fears and concerns. Okay, so how can a caregiver combat the issues of equity and stigma? First, you want to be persistent in your efforts to get an accurate diagnosis, so don't be afraid to ask questions. Second, you want to seek a second opinion if necessary, and actually even a third or fourth opinion until you're satisfied. Number 3, you want to become knowledgeable about implicit biases so you can recognize and address them. And there's actually a lot of information online that's easily accessible, and some of it will give you tips and strategies for how to address it when it presents itself, because this isn't always an easy thing to do. Number 4, be aware of your own biases and the role they play in your decision making. So we all hear, it's just human nature, we all hear and process information through the lens of our individual perceptions. So we really have to be willing to challenge ourselves in order to understand the role our perceptions are playing in our decision making. Number 5, educate yourself on the long-term and other implications of untreated ADHD. So whatever decision you make, it's an informed one, because all decisions are best made when accurate information is presented, as opposed to just being impulsively made or made based on feelings. And one of my favorite lines is, feelings are not facts. So you want to be able to separate the two of them. Okay, so if you're interested in additional information, here is a list of resources. You can contact the children and adults with attention deficit hyperactivity disorder, the American Academy of Child and Adolescent Psychiatry, Center for Management of ADHD Resources, Department of Health and Human Services Child and Adolescent Mental Health, Every Mind Youth Services, and you can also contact the Behavioral Health Department of your private health insurance to review the signs and symptoms that you notice. Also, feel free to reach out to your child's teacher to help determine if the symptoms that you notice at home are also present in the school setting, and if so, to what degree they are impacting school functioning. And then finally, if such concerns are present at school, you can also reach out to the school counselor and school psychologist about your concerns, and they may be able to provide additional services related to identifying the disability and developing a support plan if needed.